Because we now have the appropriate tools and the data behind it to do so. There has been an increase in uptake of us doing these procedures because we as interventional radiologists actually believe in the procedure now, because we actually can see the results, and we kind of are getting better and better at discerning who is going to benefit from a particular procedure more than one patient over the other.
We've all had our fair amount of experiences, I think, with perhaps other tools, often then leading to either a little frustrating results or very long procedures. And I think now, especially with the new tools available for venous thrombectomy, either on the PE side but also on the DVT side, it just makes it a lot more approachable in a way to say, okay, we'll go ahead and actually treat this patient, and it gives me personally as an IR, if I can have a reliable outcome, it makes me a lot more relaxed, and it's easier as well to actually say, okay, we'll actually do an intervention on this patient because I'm very certain that we'll have a good outcome. I'm a simple man, so I like simple tools, and I like things that I can actually understand. The first time, especially when I saw the FlowTriever device, I was like, okay, that just to me makes sense. I like things that don't have cables, which you don't have to plug in, right? And so everything basically comes in a box. It's very intuitive to use. As Rashid said, if you know how to put up a wire into the pulmonary artery, you will be able to get this catheter across. And it's a very complete package, right? Especially now with the FlowSaver, you can basically do as many aspirations as you like. You won't run into the problem of like a significant blood loss, and just filter the blood and give it back. With ClotTriever, it's the same thing. It's a very well thought through device. It's easy to use. It's very trackable. It does a very good job at extracting clot. You'll be surprised how good the results are. I was like super surprised in the first cases how clean these veins look after a couple of passes with the ClotTriever device. We do have very good amounts of data now. And there's a lot happening at the moment in the DVT space. With especially Defines, which I think is going to be very exciting and hopefully guideline changing, but also the Peerless 2 trial. I can't wait to see those results. I think especially this group of intermediate risk patients in PE, that's something where still it's often difficult to actually decide which way to go. Should we do conservative treatment or should we do an intervention?